more responsible prescription and use. I'm going to speed up because the time. I just wanted to share this one graph from, oh, you can't even see it. Okay, you will maybe see it in the handouts. So Alancet paper has done an analysis of how antibiotics which are used and consumed by countries belong to the access or watch or reserve category. And what you see here is a huge difference between some of the countries which are on the top left end, where more than 90% of the antibiotics what they consume in the country, like Netherlands, Brazil, Spain, Algeria, Colombo, over 90% are from the access, the very basic, simple antibiotics in an essential medicine list. That's what they use to treat most of the infectious diseases. While on the other end, where you see a much broader reserve and the purple color, which doesn't really come out purple on the projector, the reserve group. So these are countries like Bangladesh, India, China. Very small, you see that much more smaller, about 30-40% is only where the antibiotics which are mainly consumed belong to the access category. And a huge, another 40% maybe belong to the reserve, to the watch group, and anything between sort of 20 to 10% to the reserve group. Now these are the countries where WHO has, and under the Sustainable Development Goal as well, we now set out a goal that by 2020, most countries in the world hopefully can improve the use of antibiotics and use antibiotics, mainly 60% of them, in the access group. That will reduce the risk of AMR and can help with optimizing antimicrobial use. A long way to go for some of those countries who are on that right-hand side scale, but that's an agreed global target now. So this is just shows with some of the colors. Again, it's not so easy to look at, so we're not going to waste time on this. Monitoring antimicrobial use, just very quickly, this is really important because if you can't measure what you're doing when you implemented an intervention, you don't have the measurement whether you manage to reduce overuse or misuse. You don't know what you are doing is working or not. So we have various tools, and the two major tools I just want to quickly mention here is a sort of qualitative assessment, what was in the Lancet paper, when we tried to analyze which antibiotics, how much antibiotics are used and which proportion of different antibiotics are used, so measuring antimicrobial consumption, and a more quantitative analysis when we look at actually prescribing patterns, so point prevalence surveys, prescription audits, various tools WHO has developed for this. These are very important as well. So again, how we can use data and why it's important to measure and understand how antibiotics are used is because we can use them and identify and provide an early warning to a problem. So when we analyzed several of the Southeast Asia regional countries' consumption data, we saw in certain countries very high use of fluoroquinolones or very high use of fourth, fifth generation cephalosporins. Just from the consumption data, immediately there is a signal to the policymakers that there is a definite misuse and overuse and abuse of those drugs, and something needs to be done about it. Then interventions can be developed to address them, and we can measure that whether that intervention actually works. It's also useful to raise awareness. This data needs to be socialized. This information needs to be shared with the public, with the health professionals, with the pharmacy professionals, with industry, in order to create awareness around the problem. So I'm not going to go into how we actually do this, but just to see one example of how big is our misuse and overuse problem in Southeast Asia. These are different countries from Bangladesh to Timor-Leste, and basically the graph shows you that how much of the patients would present into a health facility, into an outpatient clinic. So these are not severe patients, these are just simply coming to the outpatient clinic with upper respiratory tract infection. So they have a cough, a cold, a flu, and they should not be receiving antibiotics at all, most of them, or very few of them who have maybe high risk because of their personal conditions. But you can see that as high as 86% or 73% will leave the clinic with an antibiotic. Now this is the problem, this is what we need to correct. And almost all countries except Bhutan, which is more to the sort of acceptable range, 30%. And I wanted to mention here that Bhutan is the only country where also we have actually very good enforcement of the regulation regarding of antibiotics. You cannot go into a pharmacy and just purchase an antibiotics without a prescription. You have to have a prescription, and they're very strict about enforcing this. Problem of Bhutan, obviously, that it has a quite long, for the small country, very porous border with India. So the patient just simply can walk over to India and buy the medicine still without any prescription. So misuse and overuse will still occur in Bhutan, even though they are very careful about not to dispense antibiotics. On quality, I'm just going to finish with these last slides. One thing what I wanted to share, that quality of antibiotics can also be a big problem. If you have a substandard, poorly manufactured antibiotic, which has only 60% of the active ingredient, that's most likely going to breed resistance. It's not going to achieve the therapeutic outcome. And in our global monitoring system, the highest two categories, the top two bar, are the anti-infectives and antiparasitics, which are reported as being substandard, poor quality, or fake drugs. It's a big business. Everyone buys a lot of antibiotics, so criminals very happily get into the business, or negligent manufacturers with weak regulatory systems, which unfortunately quite commonly occurring in this region, produce poor quality antibiotics, and that can also create this problem. So these are some of the things what regulators can do about antimicrobial resistance. The key and most important one, I'm not going to go through all of them, is really ensuring the quality and the supply chain security, making sure that there are only good quality, properly good manufacturing practice followed by the manufacturer, properly manufactured antibiotics are sold in the country, and the supply chain is also secured, so you don't have lots of illegal, potentially poor quality, potentially even with zero active ingredient. Last week in Myanmar, we had a very hot discussion because Myanmar, again, has a long border with China, and probably more than 50% of the antibiotic which is sold by the drug sellers are coming through illegal channels. So regulators have no idea what is the quality of those drugs. We have no idea whether they actually contain the correct ingredient or whether they dissolve and deliver the active ingredient. And this is a major problem, obviously, in a country where you have a very limited capacity regulatory agency. So I just finished with this slide again. As I said, I just wanted to give you a picture of how stewardship has to deal with all these different issues together with the regulation. Is very critical for optimizing antibiotic use. Thank you very much.